A Mental Health Drug Guide. Chapter 1. A Mental Health Drugs Guide. I say mental health drugs are about making money off stupid people. The truth is that most mental illness is not inherent, meaning you weren't born with an organic brain dysfunction. Most sadness, loss of focus, a scattered mind, etc. is caused by betraying your true nature by not living to release most of the natural energy inside of you. Drugs can't help a broken down soul. Loneliness or being alone is normal. We all live alone in our heads. Get over it. Almost everybody worries about money. Relationships are like a circle, round and round, up and down. Everybody feels blah when they wake up. You feel good by doing stuff. It's not depression unless you stay in bed or sit on the couch. Get off your ass. Don't take a pill. No matter how many mental health drugs you take, the only way anyone can feel good all the time is to earn their self-respect through what they do every day. If you don't release most of your natural energy every day, you will always feel anywhere from average to empty. Doctors and mental health experts have been sucked into being cheerleaders for mental health drugs, which is a huge, profit-driven money racket based on the lie that these drugs can heal your mental distress. What can really heal your mental distress is to live true to your natural potential as a human being. Psychopharmacology, pharmacokinetics and pharmacodynamics. Psychopharmacology is the study of substances that act on the brain and change behavior. These substances are often referred to as being psychoactive or psychotropic. When a psychoactive compound is administered, the substance will eventually enter the brain and affect its electrochemical function, which affects thoughts. Pharmacokinetics are those processes that involve the action of the body on the drug. A drug administered to the body is broken down somewhat by the time it gets to the brain. Biologists and other scientists have studied the processes that a number of different substances and herbs go through before getting to the brain, all the way from the stomach to the liver to the blood. Pharmacodynamics are actions that the drug or substance exerts on the body, but mostly focuses on the effects on the brain. Scientists try to analyze exactly how a particular psychoactive substance affects the brain. Blood-brain barrier info. The blood-brain barrier is a semi-permeable cell layer of endothelial cells, interior walls, within capillaries of the central nervous system, CNS. The blood-brain barrier prevents large molecules, immune cells, all potentially damaging substances and foreign organisms, e.g. viruses, from passing out of the bloodstream and into the CNS, brain and spinal cord. A dysfunction in the blood-brain barrier may underlie brain diseases. When a substance enters the body, it first goes through either the GI tract or goes directly into the blood system as within for infection, then it reaches the brain, which is surrounded by the blood-brain barrier. Blood vessels in the brain are surrounded by a coating of lipid cells that filter what is allowed to enter the brain. The blood-brain barrier is made up mostly of glial cells that surround the capillaries in most of the brain. They make up the membrane that does not allow the passage of many molecules into the brain. The factors that determine whether a substance will be able to cross the blood-brain barrier are the size of the molecule, smaller ones pass through. Its ionization, high ionization molecules are filtered out. Its lipid solubility, highly lipophilic pass through. The effectiveness of any mental health drug, herb, or supplement on the brain is determined by how well it can cross the blood-brain barrier to act on the brain. Mental health drugs info. The general categories of mental health drugs are anti-anxiety, tranquilizers, antidepressants, antipsychotic, for schizophrenics, attention deficit hyperactivity disorder drugs, mood stabilizers, drugs for bipolar disorder, manic depression, sleeping pills/insomnia drugs. The mood-elevating herbal drugs most commonly used are ginkgo biloba, ginseng, melatonin, St. John's wort and valerian. Drugs commonly prescribed due to fewer side effects are selective serotonin reuptake inhibitors/SSRIs like prozac-fluoxetine hydrochloride, Paxil, paroxetine hydrochloride, and Zoloft. Two older classes of drugs used for Depression are monoamine oxidase/MAO inhibitors and tricyclics, which have more side effects but work better for some patients. There are also newer antidepressants such as Wellbutrin and Effexor venlafaxine, which have different chemical structures than other antidepressants. If your doctor prescribes antidepressant medication for you, don't expect magical changes overnight. List of mental health drugs. goodtherapy.org/drugs/psychotropic-medication.html. Psychotropic medications. Antipsychotics. Thorazine, chlorpromazine. Trilofone, perfenazine. Stilazine, trifluoperazine. Serentil, mesaridazine. Prolixin, fluphenazine. Navenec, thiothiazine. Mobin, molindun. Melaryl, thioridazine. Loxetin, loxapine. Haldol, haloperidol. Atypical antipsychotics include Abilify, aripiprazole. Clozaril, clozapine. Geodon, ziprasidone. Risperdal, risperidone. Seroquel, quizapine. Zyprexa, olanzapine. Antidepressants. Several different classifications of antidepressants. Selective serotonin reuptake inhibitors, SSRIs. Gradually increase the amount of serotonin, a neurotransmitter, in the brain. Celexa, citalopram. Lexapro, escitalopram. Levox, fluvoxamine. Paxil, paroxetine. Prozac, fluoxetine. Zoloft, sertraline. Monoamine oxidase inhibitors, MAOIs. Imsam, selegiline. Marplan, isocarboxazid. Nardile, phenelzine. Parnate, tranylcypromine. Tricyclics, TCAS. Anafranil, clomipramine. Ascendin, amoxapine. Elaval, amitriptyline. Norpramine, desipramine. Pamelar, nortriptyline. Synquan, doxepin. Sermontal, trimipramine. Tofranil, imipramine. Vivactil, protiptyline. Selective norepinephrine reuptake inhibitors, SNRIs. Pristic, disvenlafaxine. Effexor, venlafaxine. Cymbalta, duloxetine. Anti-anxiety/anti-panic medications. Ativan, lorazepam. Buletinspar, buspirone. Inderal, propranolol. Klonopin, clonazepam. Librium, chlordiazepoxide. Cerex, oxazepam. Tenormin, atenolol. Tranxene, clorazepate. Valium, diazepam. Xanax, alprazolam. Stimulants, prescribed to people with attention deficit hyperactivity, ADHD. Adderall, amphetamine and dextroamphetamine. Dexedrine, dextroamphetamine. Ritalin, methylphenidate. Mood stabilizers. Lamictal, lamotrigine. Lithium. Most frequently prescribed psychotropic drugs. Xanax, alprazolam, 48.5 million. Zoloft, sertraline, 41.4 million. Celexa, citalopram, 39.4 million. Prozac, fluoxetine, 28.3 million. Ativan, lorazepam, 27.9 million. Desiril, trazodone HCl, 26.2 million. Lexapro, escitalopram, 24.9 million. Cymbalta, duloxetine, 18.6 million. Wellbutrin XL, bupropion HCl XL, 16.1 million. Effexor XR, venlafaxine HCl ER, 15.8 million. PsychCentral.com. MayoClinic.com/health/antidepressants/MH00071. DrugAbuse.gov. nimh.nih.gov/health/publication/mental-health-medication/compel-te-index.html number sign pub 8. horan.asu.edu/cpy702 reading/seligman/seligman.html. Mental health drug websites. Mental health and mood altering / psychotropic drug books are at #615.788 or RM315 at the library. ada.org/gettinghelp/anxiety disorders/medications.asp, medications for anxiety disorders. adlist.com/psychiatry/prozac.html. antidepressantspills.net. beforeyouttakethatpill.com. biopsychiatry.com, The Good Drug Guide, New Mood Brighteners and Antidepressants. citizen.org/e-letter/articleindex.htm, Mental Health Drugs. citizen.org/hrg/e-letter.htm, Public Citizens a Letter on Drugs for Serious Psychiatric Illnesses. dr-bob.org. dr-bob.org/tips, Psychopharmacology Tips, from the Psychopharm discussion list. emdexpert.com/compare/compare.shtml, prescription drug reviews and comparisons, from fairyfood.com. fda.gov, U.S. Food and Drug Administration. fda.gov/cder/drug/default.htm, drug information, from the U.S. Federal Drug Administration. healthyplace.com/medications, psychiatric medications pharmacology. helpguide.org/mental/medications_depression.htm, antidepressants. homeworker-sex-pats.com/anti-psychotic-drugs-2.htm. mentalhealth.com/drug. mentalhealth.com/drug-rs, information on common psychiatric medications. mentalhealth.com/p30.html. mentalhealth.org.uk. mind.org.uk/information/conference+sign and+sign training/psychiatric+sign drugs.htm. nami.org, list free mental health drug programs. netdoor.com/tildebill/prosurv/prosurv.html, Prozac Survivor. nih.health-health-medication/index.shtml, mental health medications. nccih.nih.gov/health/sdjohnswort/sjw-n-depression.htm, St. John's Wort and Depression. nimh.nih.gov/publicat/medicate.cfm, medications, from the U.S. National Institute of Mental Health. onlinepsych.com/treat/drugs.htm. parentsmedguide.org. paxil.com, drug for social anxiety disorder. pparx.org/intro.php, partnership for prescription assistance. pretiq.com, depression. prozacspotlight.org. psych.consultinghealth.com/psychiatric_drugs.php. psych.org, American Psychiatric Association. psychiatry.info/category/mental-health-screening. rxlist.com, RxList, the Internet Drug Index. smartmedinfo.com. ukppg.org.uk/helpline.html, UKP National Mental Health Drugs Helpline. xypill.com. Chapter 2. A Holistic Mental Health Drug Guide. Holistic Supplements vs. Prescription Drugs for Mental Health Problems. You create your own life, mental health, and biochemistry through how you live day after day. Mental health drugs and that lie they call psychotherapy have nothing to do with the natural, intuitive, spiritual, aesthetic stream of consciousness that is your life. Some herbs can affect mood by acting on the brain, but it's all temporary next to what's in your soul. You can overdose on some herbs which will probably make you sick. Beware that herb and supplement sellers are in the business to make money, so their claims are often wildly false. On top of that, some say you have to take this herb or supplement every day for X number of years in order to get the best benefits. Anything you eat goes through the liver. Some herbs and supplements damage liver function and cause other health problems. Despite the possibility of health risks, herbs, supplements and naturopathic compounds are usually and could be effective in helping you to cure whatever ails you. One problem is that almost no studies on herbs, supplements, or naturopathic compounds are conducted in the United States because it's not profitable to do such studies if you don't hold a patent on the product. Most herbal studies are done in Europe. A review of current literature suggests that despite the claims, some holistic products do not help relieve symptoms of psychological problems like adenosine, chelation compounds, coenzyme Q10, DHEA, dopamine, ephedrine, GABA, ginkgo, glutamine, iron, lemon balm, norepinephrine, secretin, serenase rotenin, tyrosine, uridine, vitamin B3. If there are 3 or more different herbs and supplements that claim to help your mental health condition like depression or anxiety, there is no harm in trying them all and possibly combining them. If you have some kind of mental health malady like anxiety or depression, do your own research. Try these terms in search engines. Anxiety or any mental illness, herb. Anxiety or any mental illness, supplements. Anxiety or any mental illness, naturopathy. Anxiety or any mental illness, homeopathy. Anxiety or any mental illness, Chinese traditional medicine. Anxiety or any mental illness, Ayurveda. Anxiety or any mental illness, holistic. Anxiety or any mental illness, alternative medicine. Mental illnesses and their herbal treatments. Do research by typing the mental illness along with the substance name into a search engine like depression, St. John's wort, ADHD, vitamin E, carnitine, rhodiola, omega-3, same, inositol, DMAE, choline. Anxiety disorders, general anxiety, obsessive-compulsive disorder, phobias, CAVA, inositol, St. John's wort, tryptophan/5-HTP, valerian, theanine, ginger, taurine, passion flower, chamomile, GABA, ginkgo biloba. Depression, St. John's wort, omega-3, same, vitamin E, carnitine, acetylcarnitine ALC, folate, tryptophan or 5-HTP, phenylalanine or P-rhodiola, ginger, theanine, green tea, chromium, inositol. Mania, omega-3, vitamin E, carnitine, melatonin, lecithin, magnesium, theanine or taurine, magnesium, lecithin. Psychosis, Rauwolfia, omega-3 supplement, vitamin C, vitamin E, carnitine, glycine, taurine. Tourette syndrome, sudden facial tics, Rauwolfia. Lecithin, choline, vitamin B6, magnesium, skullcap, vitamin E. List of holistic mental health drugs/substances. This article is a bunch of holistic mental health herbs/supplement one-liners I came across in my own personal research on the topic to see what was out there. You decide what you want. You can try psychotherapy, prescription mental health drugs, herbs, supplements, naturopathic compounds, or anything else you want. Figure out what works best for your malady. It might be several treatments used together. Carnosine, symptoms of autism. Chamomile Matricaria recutita, treat cough and bronchitis, anxiety, available as a supplement in capsules, tea bags, and liquid extract, contains terpenoids, flavonoids, and lactones, including matricin and apigenin, may have sedative effects. Chromium, depression. DMAE/choline, ADHD. Ginger, Ginger Zing ibuprofen officinale, a tropical perennial that grows in Asia, West Africa, and the Caribbean, antiemetic, anti-inflammatory, antimicrobial, antioxidant, antithrombotic, cardiotonic and anti-migraine effects, depression and anxiety, a treatment for loss of appetite, travel sickness, and dyspepsia. Glycine, psychosis. Guarana, stimulant. Hops, sleep problems. Inositol, ADHD. Lecithin, Tourette's. Magnesium, mania. Mate, stimulant. Melatonin, mania. Passion flower, anxiety. Phenibut, sleep problems. Phenylalanine/P, depression. Pycnogenol, ADHD. Rauwolfia, sleep problems. Rhodiola, ADHD and depression. S-adenosilelmethionine/SAME, nutritional. Supplement for treating depression, osteoarthritis, fibromyalgia, and liver disorders. Skullcap, Tourette's. Taurine, mania, anxiety and psychosis. St. John's wort/hypericin is the major antidepressant herb. There is also a class of anti-anxiety herbs used to calm you down. Ask about them at your local health food store, aka Hypericum perforatum, Tipton's weed, or Klamath weed, a herb that exists in 370 species found throughout the world, contains flavonoids and acylfluoroglycinols, especially hyperforin, antidepressant, increases the amount of serotonergic activity in the brain, and for this reason it also has anxiolytic properties. Theanine, mania and anxiety, found naturally in green tea, Camellia sinensis, and some mushrooms, reduce stress, produce feelings of relaxation and improve mood. Theine, stimulant. Theophylline and theobromine, stimulating effects. Tryptophan/5-HTP, depression and anxiety. Valerian, anxiety, relaxation, a sedative. Vitamin E, Tourette's. Vitamin B6, Tourette's and autism. Holistic mental health herb websites. 1800-wellmed.com/wellmood/benefits/benefits.htm. holisticonline.com/remedies/depression/homopathy-and-mental-health-piraki.htm. anxiety-and-depression-solutions.com/articles/treating-depression.htm. bcdx.com/herbalremedies/depression.html. bellaonline.com/articles p/art25698.asp. biologyofkundalini.com/article.php?story=herblist. claroset-nri.com. getoptimalhealthcare.com/depression.htm. herbalhealer.com/newsletters/n0602.html. instiahost.org/herbal. overcoming-depression.info/herbs to fight depression. qualitycounts.com, magnets to treat depression. remedyherbalshop.com/products/happytonic.html. rmberry.com/research/mood_regulators.html. survivalcenter.com/vitamin.html. thebody.com/nmy/pdfs/stjohns.pdf. yourfamilieshealth.com/alternative_medicine/herbs. zhealthinfo.com/remedies-s.htm.